This is an ultrasound scan of the female pelvis, in which you are seeing the uterus, the underfilled, almost empty urinary bladder, and because she was in emergency, so at times you have to scan with the empty urinary bladder or partially filled urinary bladder. So that's the reason. This is the longitudinal section of the pelvis, in which this is the uterus, measuring 8.1 centimeters in length, and measuring 3.7 centimeter in anterior-posterior diameter. This black area, slit-like area, is the urinary bladder. This is the cervix. This region is that of the female cervix. So the uterus is anteverted. The anterior myometrium is clear. This is the fundal region. This is the posterior wall. The cervix is normal. Vagina is normal. The urinary bladder. Now this is an echogenic area seen anterior to the uterus in the pelvic cavity. Here, this is the solid echogenic area. This is an approximation now. So this being the uterus, and there is history of induced abortion. In this case, V is for vagina, UB is for urinary bladder. This is the urinary bladder, and this is a collection. In fact, this is a collection in the anterior to the uterus in the pelvic cavity in a case of induced abortion. Okay, now let's see the endometrial canal. She has been catheterized, and this is the catheter bulb within the urinary bladder. This is the urinary bladder. This is the catheter bulb. This is the transverse section of the uterus. Now you see that there is the endometrial canal. This is the endometrial canal. It is filled with echoes. Measures 16 millimeters, is dilated. Should not exceed more than 14 millimeters. So in transverse section, this is the endometrial canal, which is 16 millimeters and filled with internal echoes. This is the endometrial canal. Now this is the worldly appearance, layered out echogenic material seen extending from the pelvic cavity into the anterior to the urinary bladder in the region of the pelvis, and it measures approximately. Now this collection is suggestive of bleed, keeping in view that this is a case of induced abortion. It measures approximately 6.7 centimeter by 5.8 centimeter, or 9 into 6 centimeters. This is collection and is bleed. This is a classic picture of a bleed. This is how ugly it will appear as. There are no internal calcification, there is no solid element seen, and the outer wall is thin, is well demarcated. So this loculated pocket full of internal different strength, internal echoes, medium to high level, a small amount of fluid pockets within these black areas are the fluid pockets within it. This one. So there is, and you see this tip, the brightness is increased and decreased in patches. So this is a well demarcated, loculated fluid pocket full of internal echoes, high to medium strength with no calcification, no solid element, and in the pelvic cavity extending anterior to the uterus and the urinary bladder. So this is the case of the day. Thank you.